All right, so this is going to be my week 4 fundamentals skills video, and this is going to be over my insertion of an indwelling Foley catheter. So I'm just going to do a quick scan of my room just so you guys can see that I am not using any resources. So let's see if we can do this correctly. All right, and then I'm just gonna place my phone kind of up above so you guys can see. Hopefully. Okay, I'm just gonna move some things around here just to get the best position and view that you guys can see. So the first thing that I'm gonna do is just knock on my patient's door. I'm gonna come in, I'm gonna introduce myself, let them know kind of what I'm about to do and about how long it's going to take, and then thank them, all that kind of stuff. I want to go ahead and identify my patient. So I want to ask them their name and their date of birth. And then I'm going to pull up my computer and just, verify that I have an order to put in a Foley catheter. And then I want to assess their allergies as well. So any allergies to like latex, iodine, chlorhexidine, or shellfish. I want to assess those before I even start. I'm gonna provide privacy, so just pull the curtain or close the door if you haven't already. And then, as I said, do my hand hygiene on the way in. But if I was touching the computer and stuff, then I would want to go ahead and do hand hygiene again. So I'm gonna go ahead and just let my patient know. I mean, they probably already know that the catheter is, gonna be inserted. But just letting them know why we're putting the catheter in. So if they were retaining urine, or multiple straight caths have occurred and the Foley needs to go back in. And then I'm gonna let them know that I'm gonna do, I'm gonna clean really well before I insert it. I wanna get their consent for that. Just, ask them, hey, is it okay? I think this is important, you need this. I need your yes or no for this. And then if they have any questions, give them a chance to ask any questions too. Let them know that it usually, you will feel some pressure, which you usually tell them that when you're doing it, but just letting them know those things. So after that, I'm gonna go ahead and just kind of get everything ready. So what I like to do is raise my bed up to appropriate height. And then if I'm using like a bedside table, it doesn't really matter. For now, you're gonna move this tray kind of closer to the patient anyway, so it doesn't matter. But if you did have a bedside table, just to kind of start, it would be nice to kind of raise that to level as well. I am going to kind of drape my patient. So I want to keep everything else covered and then just at least like top half. So like if I have a female especially, I don't want to just like, take everything off. So she will have to have like her legs kind of open. So obviously I won't be able to drape like lower extremities because she'll have to be kind of, everything needs to be clear, but top half you can at least drape. And then I'm going to assess my patient's kind of just like peri area. I want to assess for any like redness, open wounds, any like rashes, and then like any breakdown there I would want to know, and then any like bladder distension. So after I kind of do a little quick assessment and I drape my patient, I'm going to have her just kind of get into the appropriate position. So what I'm going to do is I'm going to have her kind of, so I'm going to lay her supine if we can, put the head of the bed all the way down. If I need to put her in like a Trendelenburg, I can, but I think for this purpose, I think just supine should help. So I'm gonna have her put her knees kind of like up like this, and then I'm gonna have her scoot her legs back, or her ankles back. I know it's kind of hard to see. So like scoot them back towards her, and then just have her legs kind of like open. So they just kind of, I always just tell my patient to let their legs fall. If you have an older patient, it is kind of hard for them to do that. So you may have to have some other hands just to kind of hold a leg kind of back. But if it's a younger patient, they should be able to do that, no problem. So then I'm gonna do my hand hygiene just after getting them in position. I should have gloves on. I don't have any of my, Actually, I do. So I would have kind of regular, I mean, you could, I don't know. I'm not even gonna put these on because you could, I mean, you should have regular gloves on. Obviously, that's a given. So anyways, I'm gonna start opening my kit here. So I'm gonna kind of just pull this tab. You can still see me. And then I am just gonna remove this. And this would be like a sanitized thing. And then I'm gonna save my bag. Let me get rid of that. And I'm gonna use it as like a trash can because I think that that's the easiest. I don't know if you can see my trash can or not. I think you can. Okay, so, sorry, I just want to make sure you can see everything. I think you can still see the trash can. Okay, so what I'm going to do is I'm going to go ahead and open my, I'm going to open up my, my kit. So the first flap is going to go away from me, and I'm going to note that 1-inch border, and then I'm going to actually scoot this over. I don't want to touch my, my water bottle, my patient. So side, and then lastly, I'm going to do this one. So then I'm going to go ahead and pull out this drape. Sorry, I don't know what that noise was. And again, I'm going to be mindful of this 1-inch border here. And then I'm going to just kind of drape this under my patient. So this is going to go right under my patient. Oops. Sorry, I want to make sure that you can still see it. Okay. And I'm going to scoot this over just a little bit. Okay, so next thing that I'm going to do is I'm going to go ahead and remove my gloves. And not really remove them, but take out. So I'm going to set that there. And I'm going to go ahead and put those on. And obviously I would do my hand hygiene before I put these gloves on. Okay, and then I'm gonna just go ahead and put this over my watch here. Sorry, I should make sure that you can see that. Okay, so now my hands are sterile. So I'm just gonna get rid of that. I'm not gonna crumple that up and put it in the trash can because it's too much. This one you can use, I think this is more for like, I mean, I honestly don't use this. I don't know if you want us to use it, but I don't feel it. Sometimes I do with the males more, the males than I do the female, but since you have the sterile drape underneath, I don't feel like it's necessary to even use that. So I just take that out and throw that away. So next thing I'm gonna do is I'm gonna pour my iodine in, get my lube ready, and then attach my syringe to my catheter. I'm gonna go ahead and do that right now. And then I don't need this. If you did need a specimen, you could use that, but I don't need one, so. Okay. So I'm gonna go ahead and try not to make a mess here since I am at home. Okay, and then I'm gonna put that in the trash. And then what I'm gonna do is I'm gonna squirt my lube in. And then I'm gonna go ahead and attach my syringe. Just because I just wanna have that already attached. And I'm not going to test my balloon. So I'm just gonna have this attached. And then I'm also gonna go ahead and take my, make sure that you can still see, sorry. I'm gonna go ahead and take my catheter out of this plastic. So you just kind of like wrap, sorry, it's so hard to do with this. It's like stuck on there, dude. So you just kind of like wrap the catheter as this comes out. Okay, and then I'm gonna go ahead and just set that back in there because that's sterile. Okay, so after I get everything ready, attach my syringe, take my covering off of my catheter, I'm gonna go ahead and just move my entire kit in between my patient's legs. So I'm gonna just go ahead and take this and I'm gonna move it. And sorry, I just wanna make sure that you can still, all right, I'm gonna just adjust here a little bit just so you can see. Sorry, I know this is like not, I know it's not ideal, but I want to be sure that you can still see this. And I also forgot to take my cap off, so I'm going to go ahead and take my water bottle cap off right now. But obviously, I would not have a cap to take off in real life. Okay. So what I'm going to do is I'm going to take my non-dominant hand. So I am left-handed, so I'm going to take my right hand and I am going to just kind of spread the labia kind of back. I hope it's really hard for you to see, but I mean, I don't really have a labia to spread, but you know. So I'm just going to spread this back and I'm going to go ahead and, so my, the meatus is going to be exposed here. So what I'm going to do is I'm going to take my dominant hand and I'm going to go ahead and, so I'm going to do one swipe. I'm going to do like on the, sorry, I'm trying to think. So I'm going to do center first and then get rid of that. So I already wiped that one and this is still keeping it open. Then I'm going to do one side, get rid of it, do the other side and get rid of it. So I did 3. Okay, so next what I'm going to do is, so I still have my hand, I'm not moving my hand, I know that I am moving my hand, but I would keep my hand here with the, have the labia majora open. And then what I'm going to do is I'm going to grab my catheter tip, maybe, and I am going to put my lube on. I honestly should have did the lube before, but that's okay. Okay, so I lubed up my thing and I still have, sorry, I just keep moving. Okay, and then I am going to okay, so what I'm going to do next, so I still have this labia kind of exposed here. And then what I'm going to do is I'm going to just go ahead and I'm going to insert. And I'm going to move this actually out of the way because I don't need it anymore. So I'm going to go ahead, and I know it just fell out. Okay, so I'm going to keep inserting here. I still have my labia exposed. And then as soon as I see a flash of urine, that's when I'm going to, sorry, it keeps like falling out. I know in real life probably wouldn't be like falling. Okay, so let's say I already saw my flash of urine. So what I'm going to do is I'm going to advance it about 1 to 2 inches. So let's say advance a little more. Sorry, this is really hard in a water bottle. Okay, so I advanced and then I'm gonna go ahead and blow up my balloon. Maybe. Okay, so my balloon is inserted and then I'm going to release the labia. And then I'm just going to pull back on the catheter here So it's stabilized right now. So it's obviously not coming out, and that's as far as it's going to go. So I'm just gently pulling on that. And then after that, I am finished with my insertion. Well, I mean, I would put my, I don't think this one has a stat lock in here. So if I had a stat lock, then I would go ahead and put my stat lock on now just to stabilize it. And then this would be filling up with urine, and I would just hang this on my bag. So this would be where my stat lock would go, and then I would just put that on my patient's leg. So I'm gonna go ahead and take off my sterile gloves. And then do my hand hygiene, and then, you know, lower my patient's bed if I had it raised and all that good stuff. And then I had already said that I was gonna secure it. So obviously, you know, securing. And then I wanna make sure that my peri area is like clean. So a lot of times you'll get like, I feel like the iodine is okay to stay on there, or the betadine, sorry. And then, but you do wanna make sure it's dry just cause like moisture can build up in there and you don't want to have that. So make sure that your peri area is, you know, clean and dry. So what I'm gonna do is I'm gonna go ahead and remove my Foley now. So this, I would just need some regular gloves. I'm actually gonna keep this syringe, but I am gonna just move this out of the way. So let's say, you know, I have a syringe here. Let me put my gloves on. So I would do my hand hygiene, obviously, before taking this out. And then, so let's say I have like a, sorry, I'm trying to think. So my normal, just like a saline syringe. So I would just take it out of the package. I would push that saline out, and then, so I would have an empty, syringe. So what I am going to do is, I'm gonna just attach the syringe to the port here that I blew up the balloon with. And then I'm gonna just pull back the plunger here, and I instilled 10 mils. So I just wanna make sure that I, you know, get the full 10 mils out, or as much as I possibly can, because you don't wanna pull that out when the balloon is still inflated. So what I'm gonna do is I usually have my patient, I usually say, you know, take a deep breath for me, and then when they breathe in and start to exhale, then I would just take the catheter, and then I would just pull it right out, and I just kind of loop it up like this. And then usually I would empty my bag. Like if there was urine in the bag, I would empty my bag before like throwing it away. You wouldn't just want to throw the bag away with the urine. But then I would just take this whole thing, so my bag's empty, and you just put it in the trash. Oops. So then I'd obviously take my gloves off, and then I would do my hand hygiene. And then before leaving my patient's room, I just wanna make sure that their bed is in the lowest position, and obviously I would clean all this up too. But bed is in the lowest position, bed is locked, chair alarm, bed alarm is on, call light is within reach, and then I would do my hand hygiene again as I come out. And then as for documentation, so what I would do is, hopefully I have, you know, you wanna be charting in the room. So trying to chart it right after you insert it, especially, I like to, well, usually we have to like scan the patient, like the tag, because you have to charge your patient for it. And also I like to know what French, I can't tell you how many times I've grabbed like, you know, a 16 French catheter and I forgot what French it was. So I like to have that right there, and I'm already in the room, and if I throw it in the trash, usually it's within eyesight, so I could just be like, oh yeah. So like this one, you know, I put in a 14 French. So it's important to, you know, it's important to do the assessment in the room. So I would want to be documenting, so you looked at your skin while you were already there, you know, at least like the peri areas, so you can be documenting that. I do want to make sure that I'm in the right patient's chart, so asking their name and their birthday. And then you could also just be, if you did like an abdominal assessment, If they're alert and oriented, you would want to document that. So then after that, like I said, you want to do the what size French you did. So you did a 14, we inserted a 14 French. So, and then what today is. So usually they do like time and date. You just plug those in, plug what French you did. We did sterile technique when we did it. And then amount, usually it'll say like amount you filled it with. So 10 cc's and then like what the actual capacity. And I think it's 10 normally. Well, yeah, I think it's 10. And then if when they did have output, like if there was like an odor or anything like that, you would want to note that. And then catheter, like the patency of the catheter. So just making sure that, you know, urine is coming through. If you got the flashback of urine, then you're obviously in the right place, and you just want to make sure that it's still, you know, it's draining. The amount, if an initial amount came out, like I know sometimes you bladder scan your patient, they say to put in a Foley, and they initially put out like 600 mils, you would want to go ahead and empty that and note that, just because that's your initial output. And then how, you know, like what color is it? Does it have any like sediment, any hematuria, anything like that? You would want to chart that. And then when you're, so I'm going to document, so that was my insertion. So now I'm going to document my, you know, removal. So I want to document the time that I removed it, the amount that I pulled out from the balloon, so the 10 cc's. And then if you're unsure, like let's say you only got out 9 cc's, you could check your charting, the person that inserted it, because you should be charting that, you can check. So if they only filled it, like let's say they only filled it 8 cc's and you can only get 8 cc's out. At that moment, if you're like, well, I don't know, should I, and nothing else is coming out, then you can check your charting and be like, oh, okay, they only put 8 cc's in, so I'm only expecting 8 cc's out. So that's kind of nice when you do chart that, you know, you should be charting that. And then you want to make sure that, you know, it'll ask if the balloon was deflated entirely before you took it out. So that's important too, because you don't want to risk, you know, injuring your patient because you didn't deflate the balloon all the way. And then also, like I said, emptying the bag before you remove it, just so you can take the whole bag and throw it away. So you would want to document if you emptied it prior, if you documented 400, then you would want to document that, the color of the urine, and then was it clear, was it cloudy, did it have sediment, anything like that, you know, did it have an odor? That's important to note too. And then usually when I have my patients, when I take their Foleys out, I usually say, so this is, you know, I'm going to take this out. I'm going to give you 6 hours to void. If you don't void within 6 hours, then we will do a bladder scan. If the bladder scan shows over X amount, whatever your hospital policy is, then we'll go ahead and do a straight cath. So I like to warn them just because, I mean, you should be letting them know what's coming just so they're not like, what do you mean I only have 6 hours to pee? But I think it's also like a motivation because when you have a back surgery and you take their, you know, take their Foley catheter out and you're like, all right, I'm giving you 6 hours to pee, and that patient knows like, okay, I need to get up and pee if I can because I don't want a straight cath back in, and I sure as heck don't want a Foley back in. So that's just my technique. So I usually just tell them, you know, letting them know early that you have 6 hours and that it's an expectation that you should be peeing within those 6 hours. And sometimes it doesn't work, but you know, just letting them know. And then when you perform that teaching, just letting, you know, documenting what the patient's response was. Did they understand it? Even doing like a teach back saying, you know, how many hours am I giving you to pee? And they say 6 hours. So then you could document that. And then you would just want to save your, so in Epic, you would want to save it and it would attach your name and your initials to it. And then I think that's it. I think that wraps up my video.